there are switchboards in the brain that cause a change in the way nociception is perceived as pain. So we're now talking about that upper level brain function. And one of the switchboards is involved with COMT, catechol-methyltransferase. It's an enzyme that metabolizes dopamine. And what we know is there are variants of COMT, some of which readily transmit nociception to pain, others of which slow down the transmission. So let's say this guy, what's your name? Tom. You look like a pretty ruddy guy, he's pretty hardy. Let's say Tom has a slowed transmission. He has a variant of COMT that does not allow good transmission. So I poke him and he says, don't poke me, you know, dude. And your name is? John. John. John, I poke him and he's like, ow, that really hurts. Now what would we say about John? We say John's a wimp. You might be. You know, we would make a judgment about his perception of pain that has nothing to do with what's true. Because what's true is he has a variant of COMT that makes it hurt worse when you poke him. That's what we're dealing with central pain. That's what we're dealing with fibromyalgia, sort of unexplained, out of proportion pain for the physiology that we can understand. If you looked at an fMRI of John, if he had this condition, we would see a heightened sensitivity inside his thalamus and his somatosensory cortex. But we can't do that in an office. So he walks in and he says, it hurts me, you know, that woman had a 10 out of 10 headache, whereas, you know, tough guy over here would have that same headache and he'd say, it hurts, no big deal, come on, let's move on. So there's two things that predispose to different COMT levels. One is genetics. Think about the genetics of people in your practice who have a chronic pain syndrome. Typically, you will find somebody, 50% of the time, you'll find somebody in their past who's had a chronic pain syndrome, or also likely that they have a child. So a mom with fibromyalgia, a grandmother with chronic headaches, and a youngster who's coming home from school once a week with abdominal pain of unexplained etiology. That's the syndrome. The second thing that predisposes and changes COMT is trauma. We've got a fair amount of data suggesting that people who've experienced trauma have a variant of COMT and they end up, in essence, feeling more pain than they should, that makes sense. So the transmission is more efficient in traumatized people. We're talking about people who've been sexually traumatized. We have a whole cadre of people coming home from the military who've had horrible trauma over there, and they are on, they're in trouble because they have a heightened pain sensitivity and they're heavily medicated and we just don't have anything to do for them. And then we have one study that says kids who were born prematurely and end up in an incubator away from touch, that's a form of trauma, and 50% of them end up with a chronic pain condition later